University Hospital of the West Indies. And I want to just read a brief statement, but just add to what he said. Uh, I'm giving a statement to Parliament today, coming on the heels of a discussion yesterday at Cabinet. We take this issue very seriously, and we believe it is better to err on the side of caution in terms of taking a very proactive position. And I am prepared to say that I suspect that is what the university team did in terms of evaluating and assessing and considering all options as it relates to this particular case. So in terms of the later today at 2 p.m., I intend to give a more comprehensive statement. But since I have you all here, and we called you here because it is almost as if there was national panic coming on the heels of the discussion in social media world and otherwise about this possible case. We decided that we would not wait until the parliamentary statement was read. But that statement will be done, and greater elaboration on the government's approach and action will be discussed. But in terms of our preparedness for the coronavirus, we have had discussions, as I said yesterday, at Cabinet, and we invited the Pan American Health Organization rep to be there, and she was there, commented on the issue. The technical team of the ministry was also present, and those discussions considered the nature of the virus.
Here, Professor Boyne, Dr. Azinger from the lab, Dr. Alison Nicholson, and our CEO. We met this morning, and we looked at the case definition again, and we would compare what a patient has with that case definition, and this patient falls outside of that case definition.
That's it? Are you adequately addressed? Huh? Okay. You must understand that this was not a planned press briefing, so I'm consulting as I go along because I want to be responsive and not be accused of ignoring the calls of the media. No, I'm just being told by the PS that there are some
the thermal scan.
thermal scanners that are going to be deployed based on what we have in inventory to boost the capacity of that instrument.
Case definition, can you be a little bit more specific?
You want to go, Karen?
So the case definition is an acute onset of a fever and respiratory symptoms, and with a travel history to a place that would have active transmission. So first, we would have to complete the fever. The person did not have a fever. The travel history was to China, but in a place where this was not circulating. Also, we are just outside the incubation period, which is 2 to 10 days normally, but may extend to 14 days. So the person would have left China on the 13th and arrived here on the 14th. So today is the 28th. Yes. So we are just outside because they would have left China on the 13th. So we start counting on the 13th, yes? And so we are outside of that period. So persons get ill for other reasons. So UHWI did the correct thing, and they alerted, and they, but at the end of the day, it's not a suspected case and would not make the requirement to send in that sample abroad because we could not send it. They would not receive it from us, even if we tried to send it. Just, we just want to make sure, we want to tell the public this is not it, and we have proof. That's not how it works. And so we would not even be able to send that sample.
So it's a process of risk assessment.
Okay, so it maybe a few days to get the result. First of all, we have to transport it to the site that will test, and based on their turnaround time, we will get the result. Pardon me? That's the possibility. PAHO would. I don't know if do you have a time yet? Mhm.
Jamaica is very fortunate in having a national influenza center. And PAHO WHO, up to the end of last year, was doing training with the laboratory and the national laboratory and the national influenza centers. So we know that in terms of information systems and capacity, they were up to speed. WHO is expecting that we will be able to send the specific reagents to all of the national influenza centers within approximately 2 weeks. And then the local national influenza centers should be able to conduct the necessary tests locally. We'll also be sending the test and the reagents to CARFA as well. So both the National Influenza Center here in Jamaica and CARFA will be getting those reagents at the same time, and will have the capacity to test.
We do have Dr. Alison Nicholson from Microbiology, Infection Prevention and Control, and Dr. Azinger here. So afterwards, if you want any specific questions regarding how the process takes place in terms of testing, you can consult with them, but they are here.
One quick question. You did say that the patient did not present the case definition for SARS. What did the patient present?
I'm sorry.
You did say the patient did not present what you call the case definition.
With the case definition.
What did the patient actually present?
Yeah, so I understand that you want to get details. We have to respect our patient's privacy. But in this case, the patient did not have a fever over 38, and the patient did not have the respiratory symptoms that are discussed in the case definition.
Sorry, you're not answering the question.
Yeah, because
The patient's name or where the patient is from. I'm asking what symptoms to this patient is 1 out of 2 million people in Jamaica present.
Yes, and I am saying to you that we have a case definition, and the patient did not have that case definition. So I think we'd rather not divulge the specific patient's symptoms, sir.
remember, no, it's not a matter of there are certain protocols that governs the confidentiality around patients and their treatment. The truth of the matter is that you didn't request a name, and I appreciate that, but the attention given to the university hospital since this news broke could create a scenario where that patient could be identified or revealed by some way, shape, or form. We're trying to avoid that. I think what is most important is that the clinical team, and there are several of them in the room, not just Dr. Bruce, he just outlined a few others, and you can have a conversation with them after. What I'm relieved about are two things. Firstly, that the university team acted responsibly by assessing the risk, given the travel history of the particular individual in question. And secondly, of course, that they were able, with their combined capacities, rule out that the coronavirus exists. Now, I'm a little disappointed that we made heavy weather of it in the media space so soon, because it has certainly turned the country into almost a panic mode. I understand the issues, I understand the need for concern, but it was important, I think, and it is important now to clarify that this is in fact the case. I want to mention one other thing quickly, and we're going to have to wrap up shortly, but the discussions this morning with the Chinese ambassador and his delegation at the Ministry of Foreign Affairs and Foreign Trade was a mutually respectful one. It was open, it was transparent, it explored all the possibilities It recognized the friendship that Jamaica shares with China in a number of areas, both in business, culture, and all the other areas that are good for both countries. Education, we have students there studying, the Confucius Center, we have Chinese here teaching our own locals. And the decisions taken around the travel advisory are based on that recognition of our friendship. And I say that to say I do not want this to be interpreted in any way, shape, or form as a hostile position. And indeed, I would go further to encourage us not to use this opportunity or this position currently, and I mean us in a broader sense, to take any position that may be interpreted as being discriminatory to our Chinese nationals who are currently in Jamaica. The risk is recognized on both sides, and what we're trying to do is to cauterize and to manage that risk. But it makes no definitive statement or no statement at all on the quality of the friendship that we share. And indeed, the ambassador has asked me to extend his own appreciation for the discussions and the positions that we have taken in the interest of all concerned. Okay? Any final question, or you can pick up after? Okay, final means one, but okay, two after that, no more. Yes?
Hi, I'm Kenny Stein from the Jamaica Observer. I remember at the time of the Ebola outbreak, there was a quarantine facility being set up at the National Chest Hospital. Can you speak on how equipped and the capacity that can accommodate in the event that the virus gets here?
You want to speak generally on quarantine? Because there are different
Isolation.
elements, isolation, different elements. Yeah?
Okay, so all health facilities have some level of isolation, and because of how it is right now, it will be treated at the major hospitals that we have. The facility at National Chest would not be used immediately, but we are revitalizing that matter.
So it would be all
All hospital, because of how it's transmitted, it can be treated at all our hospitals, and there are isolation facilities at our hospitals.
Can I just say something, because I hear the question. I didn't respond to Shamela's inquiry about our health personnel at the ports and equipment and so on, and I think it's a valid concern that is raised, and we appreciate when these things are raised in the public's interest. But let us not forget that Jamaica as a country, with its existing infrastructure, existing personnel, have done what is, I believe, a remarkable job in managing external health risks. We managed to keep yellow fever out, malaria out. I mean, obviously you have a few cases but not to the point where it becomes a crisis. We had the SARS virus. What's the other one called?
MERS.
The MERS virus, which are all comparable, at least in terms of the novel virus, meaning a new virus, to what is now the case. And we have been able to overcome those risks. And that's because we have a fairly resilient system. Our personnel are adequately equipped, or they make themselves so in the case of new threats. And I am sure we will be able to manage this one. Now, I am not saying that there aren't margins of error and that you will always have a risk of an imported case. We have to prepare ourselves to deal with it. But I don't want the population to believe that we are less than adequate, if you will, to both study, understand, and address the issue. And we are making these statements because we think the public must be kept informed, and we have tried to be as transparent as possible in so doing. Okay? Thank you very. Oh, yes, I promise you.
Hi, Dr. Tucker. I'm Aladila from Xavier. As it relates to thermometers and measures such as screening at the airport for persons coming from the US and Canada,
No. Well, the screening is ongoing. So yeah. I mean,
There's no
there,
transmission in those
it's
places.
ongoing. Now, these countries have identified a few cases, 1, 2, 3 cases, and they have taken, based on the discussions, either directly or through PAHO, WHO, other organizations that we share, they have taken steps or measures to isolate those cases and to deal with those cases. And so the assessment of the risk associated with those jurisdictions are nowhere as great as in this case where in China, although things are being done, it's the origin and it is also spreading at a much more rapid rate. It does concern us that we have seen a fairly fast pace of spread to other countries, and that speaks to the international nature of China as a country, where people visit and people move around. Up to last night, I believe the virus was picked up in 15 countries, and up to a few days ago, it was in probably 8. So it does suggest that there is a risk, and so that has helped us to conclude on the travel advisory. But at the same time, we do not assess in equal terms the risk in a country where you have 1 or 2 cases, as is the case with China, where the virus originated and where you have many more. All right, I really appreciate the time. Thank you very much, and we will keep in touch.
Appreciate it. Sorry to delay. Yes. Just get all the facts.